members, this will be a panel discussion on some of the difficult issues raised by the president and some of the, you've seen today a big overview already of some of the issues facing us regarding our healthcare workforce. Here today, we have 6 panelists who deal with such challenges on a daily basis, and they will discuss with us some of their innovative approaches for meeting those challenges.
Yes, ma'am. Thank you, Chair Burton, and thank you for the opportunity to join this panel today as the legislature looks at ways to invest in the future of Florida's healthcare workforce and our ever-growing nursing shortage. My name is Jennifer Lawrence. I'm a registered nurse and the Chief Nursing Officer with Aston Health. We operate 41 nursing homes and 3 assisted living facilities here across the state of Florida. I'm also the Vice Chair of the Senior Clinicians Committee for Florida Healthcare Association, representing over 600 skilled nursing facilities here in our great state. I've spent more than 30 years in the long-term care industry, and I'm extremely concerned about the future of our workforce. The shortage of trained caregivers was magnified by the pandemic, for sure. And unfortunately, long-term care, which lost 10,000 jobs as a result, has yet to recover. In the past 10 years, the number of individuals testing to become certified nursing assistants, or CNAs, has been reduced by half. Just recently, the federal government proposed a national staffing mandate that excluded LPNs, or licensed practical nurses, who are critical members of the care team of the next step in the career ladder for our CNAs in the long-term care industry. We're losing our frontline caregivers at a time when more and more seniors are relying on long-term care. If Florida is going to be the gold standard for quality long-term care, we've got to look at recruiting a new pool of applicants to meet our seniors' needs. My care centers have done everything from wage increases to sign-on bonuses to recruit staff, but there are still barriers beyond our control. Many of our staff are females, working moms who struggle to make ends meet. Assistance programs for affordable housing down payments and child care specific to healthcare workers could be something that would make it easier for those individuals to consider long-term care as a chosen field. Tuition reimbursement or employee grant programs to encourage individuals to choose long-term care could also help with attracting a new pool of talent. In my previous company, we partnered with local community colleges. They offered scholarships to individuals seeking to be an LPN. At that particular company had the capability and resources to provide that. However, not every nursing home in the state of Florida can do that. And there is really no guarantee that after you pay for their tuition and you get them through the training that they will come back and work for you for any extended period of time. Some of our Florida healthcare centers are also partnering with local colleges and career source boards to advance and upskill their current staff. At Aston Health, several of our centers are serving as CNA test sites and clinical sites for LPN and RN programs to expose individuals to long-term care. And we also run a large number of PCAs, the patient care assistants, that became very prevalent during the pandemic. We run a lot of them across all of our centers, and that's a really good first step in getting people into long-term care. It's a very good entry point for them and hopefully encouraging them to go through the ladder from CNA to LPN to RN and staying in long-term care. At Brooks Rehab, CNAs are being trained on-site by an instructor from Florida State College of Jacksonville, with their training costs covered by Career Source of Northeast Florida. Pines of Sarasota just graduated its first LPN class after partnering with Suncoast Technical College to train their CNAs through support from the Line Fund. These programs are successful because the training takes place at the nursing homes, helping to relieve the CNAs not only from what it costs to pay for training, but also challenges of finding childcare or transportation because they're already on the job site. Not every nursing center can afford to offer these scholarships, and resources and programs offered through such establishments as Career Source or a local college, for example, vary from region to region here in Florida. The availability of these are just not there across the whole state consistently. And what this means is that our nursing centers are not only competing with hospitals and other healthcare providers for talent, but also for the resources to help offset those training costs, which can help retain the staff when they're looking to advance their careers. I started myself as a CNA and moved up the career ladder to LPN, then RN. We'd love to see the state provide incentives for mentoring or even career ladder scholarships that would encourage staff to stay in long-term care and work their way into registered nurse positions or other roles in aging services. Could the legislature offer additional or new financial support or subsidies to universities, community colleges, or technical schools to incentivize them to train individuals specific to working in long-term care? Is there a way to standardize the approach of our local career source boards to make it easier for individuals and healthcare providers to navigate the resources that are out there and available? Requiring LPNs and RNs to do their clinicals in a geriatric setting would also heighten awareness about opportunities in long-term care and also improve our nurses' knowledge in caring for our aging population, which we see across all the continuums of care. While the staffing shortage can't be solved overnight, I do believe it's important that we have a level playing field for all healthcare providers. We need strategies to address the challenges such as assistance for potential and current caregivers, educational opportunities, streamlined pathways to develop their skills and resources, and to help nursing centers build a strong pipeline for the caregivers. Florida Healthcare Association wants to be part of a solution, and we look forward to partnering with the legislature and those on the panel and any other healthcare providers to keep a focus on long-term care and really the focus on how we can combat this nursing shortage across all of our continuums. Thank you, ma'am.
Thank you very much.